Good morning, good afternoon, good evening, everyone. I'm very pleased to share with you this topic regarding running and knee arthritis. I would like to share this presentation with my co-author, Dr. Sapé Marinier. We did mostly all the research regarding this topic. I have no disclosure. And we know running is the best exercise to improve cardiovascular system, musculoskeletal, respiratory, and generally all the else. That for sure, it's proven. But the main question when you see a runner at your clinic, they will ask you, is running associated to an increased risk of knee arthritis? And especially I see more and more people doing trail, ultra trail, so long running but with a lot of downhill and uphill. So I'm going to try to answer to this question with an overlook of the literature. We know for a knee arthritis there is some risk factor which are mostly obesity and knee injury, previous ACL with meniscus lesion. What's about running? There is a very nice paper published long time ago, more than 30 years ago, comparing runners versus non-runners. It's a very nice study because it has been done for long distance runner doing more than 40 years of running. So this study has a very long time follow-up. Those runner was doing running between 20 to 40 kilometers per week. And what they found, comparing two groups, so one group of runners and one group non-runners, they didn't find any difference in osteoarthritic degeneration in both groups at long-term follow-up. Another very nice study, a German study published in German 15 years ago, they look for a high-level runner and a long runner. So they look for 20 elite German marathon who had active careers during the 70s, 80s, and again with a very long-term follow-up between 20 to 34 years. And they found for those population in this study, osteoarthritis for the knee was very rare for this patient, and it was most maybe common for the hip. But now if we look the meta-analysis, I will share with you two meta-analyses. This one from Carlson and Volker Mussel. They look for many studies, including more than 100,000 patients. If you can see the flow chart here. And what they found is maybe different than the previous study I just shared with you. They found a higher risk for hip or knee osteoarthritis for competitive runners. But they found a significantly lower odds for osteoarthritis for runner at recreational level. I would say the runners, as you can see in my country, the people who run every Sunday 10 kilometers. But which is important, it's associations for this at recreational level for runner doing that for more than 15 years. So there is a relationship between the running and also to do it for a long time. They were not able to demonstrate any influence of associated risk for age, sex, weight, and previous injury. Another meta-analysis performed in the US regarding different sports and the risk of knee osteoarthritis for those sports. And they found elite level long distance running was a sport with a higher prevalence risk of knee osteoarthritis as the previous study. So another question when you see runner is, okay, I have osteoarthritis now, I want still running. I try all the medical treatment, I've seen Pelfun, but I want to keep going running or trail, long distance running. What can I do? Is a surgery a solution for those patients? Just quickly, we know there is a study regarding osteotomy around the knee and sport, return to sport, and we published a long time ago this figure, and we can see, I'm sorry, it's here, it just, you can see that because I have just my camera here. So here, that is runner. That means in 2/3 of the case, patient with osteotomy will go back to run, and sometimes I have some patient doing marathon. So osteotomy can be also a solution to treat patients with osteoarthritis and patients who want to keep do running and some other sport. Of course, we can discuss to do uni or osteotomy, and I will just finish with this study comparing strenuous activities and for HTO and uni, and for jogging here. And what they found similar outcome for patients considering jogging for uni or ITBL osteotomy. So what is the take-off message of this topic? Regarding the literature, intensive professional runners may be at risk of knee arthritis regarding meta-analysis, but recreational running is associated with lower knee arthritis when it's performed for up to 15 years. Thank you for your attention.